There we go. So we're going to talk. Oh, there we go. Okay, so we're going to talk a little bit tonight about vision and reading. So let me just pull my slides back up here so I can see what I'm doing. That'd be useful. Okay, so we're going to talk about some tips for unlocking your child's reading and vision potential. So who am I and why should you care? So I'm the clinical director and the owner of the Vision and Conceptual Development Center, and we are a neurodevelopmental optometry practice. So it was started around 1990 by Dr. Harry Wax. I've got some, differing info on that, but approximately 1990. Dr. Green, who was not available tonight, she joined the practice actually around 2005. I came in 2006, and as I often like to say, Dr. Green was a smart one, because she did not buy the practice from Dr. Wax. And then this past year, Dr. Ifunai joined our practice just in September, so he's going to introduce himself momentarily. And right now we have a team of 6 vision therapists, and 5 of those therapists have been with me at least a decade and have achieved certified optometric vision therapist status. And we are looking for more people to join our team as vision therapists and as technicians. So if you know people who are good with kids, send them my way, please, if you wouldn't mind. So our practice exclusively treats eye-brain vision problems. I'll talk about what that is in just a minute. So Dr. Ifunai, if you could introduce yourself, please.
Sure. And I'm not sure if everyone can see me. I think you're about to share my screen. Are you able to see my picture in the...
I can see you. I turned the share screen.
Okay, perfect.
Yep.
Awesome. Hey, everyone. I appreciate you guys joining us tonight. My name is Dr. Leslie Ifunai. It is my first year joining the practice. I'm super excited working as a neurodevelopmental optometrist. I particularly specialize in strabismus, neurorehabilitation, as well as traumatic brain injury. And the new area that I'm actually bringing to the practice is sports vision. So any athletes that may have had a concussion, or even if you want to establish baselines with those particular athletes in their particular sport, when it comes to eye teaming, eye tracking, depth perception, as well as visual information processing, we'll definitely be able to take care of them.
Thank you. So Dr. E is a great asset to our practice. I'm really excited that he's here. So as I mentioned, eye-brain vision problem. So you might be asking yourself, what the heck is an eye-brain vision problem? And I will tell you. Before that, I want to tell you a little story about this kid here. At 6 years old, he wasn't reading and had an eye exam, and everything looked pretty close to normal at that point. Maybe a couple things that were like a shade off, but he didn't have any complaints. He was just starting to learn to read, but wasn't reading independently yet. Well, by fall, his teachers were telling his mom that, he's starting to get interested in reading, but every time he reads for more than a few minutes, he's rubbing his eyes, blinking a lot, squinting, rubbing his eyes. And they, brought this concern up. And sure enough, this young man had convergence insufficiency, which is a condition where the 2 eyes don't look at the same place at the same time when viewing close objects like a book. And that was why he was having so much trouble. He was also having trouble with making his eyes track appropriately across the page. So he did vision therapy with us and now is an avid reader to the point where he's constantly stealing my Kindle. This is my own child. One of 3 who is 2 of 3 who's been through vision therapy, and the 3rd one is starting. So If you were wondering about whether this stuff does run in families, seems to. So before I talk about eye brain vision problems, let's talk a little bit about what vision is. So probably in school, you learn something along the lines of your eye is like a camera. And there's some truth to that. It's an oversimplification. And we'll talk a little bit more about that as we go. One of the issues that we run into with families is that they've been told that their kid has 20/20 vision and there's nothing to worry about. This is a problem because 20/20 vision is just one piece of things. So people hear 20/20 and they think, oh, well, that's perfect vision. I don't have anything to be concerned about. But for some reason, my kid's not reading still. I don't know what's going on. So what 20/20 means is that you're 20 feet away from the eye chart. That's the standard distance anyway. A lot of optometry offices do use shorter rooms with a mirror system to give the illusion of being 20 feet away, which kind of works, kind of doesn't. That's a story for another day. And then the other 20 is just that you're seeing the appropriate size letter that you should be able to see from 20 feet away. So if you're not seeing as well, you might be seeing 20/30, 20/40. So that's all that 20/20 means. And this eye chart here that you see is over 150 years old. And, it's been updated a little bit, but it's not that different from the eye chart that is used in most offices today. The main advantage now is that we've got fancier gadgets so we can randomize the letters. So while there is some truth to your eyeball working like a camera, most of the visual processing goes on in your brain. Some of it does actually occur in the retina itself, but again, that's a story for another day. Otherwise, we're going to be here for a week. So all the different aspects of vision that help you understand what you're seeing all takes place inside the brain. So whether we're talking about the sharpness, clarity of what you're seeing, some of that is eyeball related, other parts are vision processing related. The depth of how big the object is, how far away it is from you, the color that you're experiencing, the movement of yourself through space, all of these things occur inside the brain. So when I talk about eye brain vision problems, typically we're dealing with stuff that's not just, do you need glasses to see the chart? What most people don't realize is that, depending on which resource you look at, there are at least 17 visual skills that are really important for reading and learning. I'm not going to cover those exhaustively. I'm going to talk about just a couple that are the most critical and the most common problems that we see in our practice. So here in this yellow column, that's central visual acuity. So that's the eye chart. So while that is important, it's certainly not enough because there are all these other visual skills that are related to reading, to learning, to playing sports. So to give you an example, I'm going to show you an eye chart or just a couple lines from an eye chart. I want you to read the letters to yourself. Tell me or notice to yourself how much your eyes move as they look across the letters. So you probably notice they move some, but they don't move a huge amount. So now there's a paragraph. I want you to, again, read to yourself and just feel how much your eyes have to move as you read. So one of the areas that we often see problems with in our kids is that they have difficulty moving their eyes left to right from letter to letter when they're first learning how to read, or word to word, or hopefully chunk of words to chunk of words as they become more developed readers. So if you don't have accurate eye movement skills, you may skip over words. You may mix up words if your eyes are jumping left to right and then back right to left before they should. You may skip over lines as you read when you get to the end of the paragraph or the end of the line and then have to jump back to the next line in the paragraph. You may make a mistake and either reread a line or skip over a line. So if any of those areas are not working properly, you're going to have issues. Another area that we see problems with a lot of times is keeping the image clear and single as the person reads. So in order to keep that image clear and single as you read, first you have to be able to focus your eyes on the page. And that's a skill called accommodation. And that's where you actually have a little tiny muscle inside your eyeball that focuses the lens of the eye to make the image clear. That system is what's not working as well once we get to 40 and above. Unfortunately for everybody, that we can't, that you just need glasses, contacts, whatever for. But for kids, they just might not have good control over that focusing mechanism. So the other thing that you need to do, in addition to clear, to maintain single vision as you read, your eyes have to point at the same place at the same time. So sometimes what will happen is you get a little bit of a separation there. And the kid might switch back between eyes together and eyes starting to separate. This is what was happening with my own son, is that he'd start to read and he'd be okay. And then over time, his eyes would drift apart. The images would look double and he would be blinking and squinting to try to get them back together again. So a child might start reading, and then over time, as the eyes get tired, they start to drift and you get doubling. So sometimes this is why a child might read a word in a sentence appropriately at one point, but further down, he's making mistakes. It may actually look different to him at that point. So I hope you can agree that the Snellen chart in and of itself is not sufficient to pick up these eye teaming or eye tracking problems that are important for reading among all the other visual skills. So one thing that we hear a lot of with parents of kids in our practice is that, we'll ask them when they had their last eye exam, and a lot of times they'll say, well, we had an eye test at school, or we had an eye test at the pediatrician's office. The problem is that is not really an eye exam. That's just a vision screening. And while a vision screening is pretty accurate at picking up kids who are nearsighted, which means they can see things up close and things are blurry further away, it's not very effective for picking up those problems that we just demonstrated, those eye teaming, eye tracking problems. It's not very good at picking up kids who are farsighted, which means they can see well far away, but they have to focus their eyes extra hard to see up close clearly. Those kids typically are not going to get picked up in your standard vision screening that you would do at the pediatrician or at the school. So problems that you might have, kids seeing double, kids seeing blurry up close, a kid who sees words looking like they're moving on the page, those kids are all going to pass a vision screening. So you might think, well, my kid will tell me if he's having problems. Kids don't. Unless you ask really pointed questions, children are not typically going to complain if they have any vision issues, including double vision, because they just think everybody sees the same as they do. They don't have a frame of reference to complain. So the adults in the child's life, we need to be aware. We need to be like my son's teacher, observant that he was squinting, observant that he was rubbing his eyes. At home, we were still mostly reading to him, so he wasn't exhibiting those behaviors. So this is a team approach to be aware of what kinds of behaviors kids are showing us since they can't tell us. So the most common behaviors that you're going to see that suggest a vision problem: skipping lines, rereading lines, trouble with comprehension and with fluency. So fluency may be an issue of the eyes working together as one. It may be an issue of the eye movements. It may be a problem with visual memory. So there's a lot of different areas where that might be. So it's not diagnostic, but it does suggest that there may be some sort of visual or visual processing problem. A lot of times comprehension can be damaged when the child is either putting too much work into just getting the information off the page, or it may be that they're having difficulty visualizing the scene that they're reading. So homework may be taking a lot longer than it should relative to their peers. A lot of times parents will tell me that homework is a nightmare. It's a battle to get the kid to do the homework because, and they may think that the child is just stubborn or unwilling, but a lot of times it just hurts, and that's why the kid doesn't want to do it. So that's a sign that there may be something more serious going on. Letter reversals, particularly B's and D's or P's and Q's, can be an indicator of a problem. A lot of times that's related to visual processing and understanding spatial orientation. And having a short attention span for reading, for schoolwork, and especially for non-preferred reading activities. So a lot of times parents will ask, well, if my kid is having trouble with his eye teaming and he doesn't want to read, why is he happy to play video games on his iPad at that close working distance, for hours? Well, there's been a lot of research by video game companies into making those video games extremely compelling so that children will persist, and adults, I mean, come on, who's lying here? Kids and adults will persist with video games even when it hurts. So keeping in that theme of learning difficulties coming from reading problems and vision problems in particular, even bright kids will struggle if they're having trouble keeping their eyes focused on the page. So, and another thing to be mindful of, a lot of kids just getting a vision screening and not actually seeing an eye doctor. So pass the word on. So just to give you a little or clarify some confusion of the different types of eye care professionals that people encounter. So your optician, that's the person who makes the glasses, fits the glasses for you. Your ophthalmologist, their training is 4 years of general medicine, medical school, and then they do a residency specifically in vision, eye surgery, depending on which area that they want to. If they're a neuro-ophthalmologist where they're looking at neurological disorders that are related to the eye, they're usually doing 12 years of training altogether. Typically, this is who you want to see if you need surgery, is the ophthalmologist for sure. An optometrist is an eye doctor who goes through a 4-year doctoral program specifically related to eyes and a little bit to general body medicine. Some folks do a residency. Dr. Ifnai did a residency in vision therapy. But it's not required for optometry. So most general optometrists are looking at, can you see the letters clearly? Do you need lenses to see the letters clearly? And are your eyes healthy and free of disease? And more optometrists, general optometrists, are starting to specialize in just medical eye care, treating eye disease with eye drops and topical medications and some oral medications, depending on the state. And some optometrists can actually do some laser procedures in some states as well, not in Maryland. um, Optometrists prescribe your glasses and contacts. They may do a specialty in myopia control, which is when kids are getting more and more nearsighted. There's a lot of interesting stuff in that. And then your neurodevelopmental optometrist, which is me, Dr. Ifnai, Dr. Green. We've done a lot of additional training specifically in vision therapy, vision development, vision rehabilitation. Dr. Green and I are both board certified in vision therapy and vision development. And Dr. Ifnai is working on his board certification. And like I said, he completed his residency in that area. So we're looking at more of the functional area of that eye-brain connection. So to give you an idea of what the difference is. So we're here talking about what's happening in the brain. So, oh, sorry, that slide's in the wrong spot. So we wanted, with most of the kids we work with, they're having something that's getting in the way of learning. There's a small percentage of the children that we work with where they're not having trouble with learning, but they're getting headaches. They're having other symptoms related to their performance, even though they might be getting straight A's and getting all their work done. But most of the kids, the reason that they're coming in is not because they're having symptoms, it's because their parents are concerned because they're not performing the way that they know that they should be able to. These are a lot of times really bright kids that are just struggling in this one area. So like I said, we want to start out with understanding, does the child have healthy eyes? Can they see clearly? Do they need glasses to see clearly? The next step is that eye teaming and tracking. Do both eyes point at the same place at the same time? Do both eyes work equally one to the other? Can you make your eyes land on the page or you're trying to make it land on the page? Can you track a ball that's coming towards you? The next step is visual perception, or understanding the information that's coming in through your visual system. So this is visual memory. This is being able to differentiate subtle differences from one object to another. This is being able to find your favorite toy on a shelf full of other toys. So there are a lot of different aspects to visual perception. All of them impact how we deal with the world. So putting it all together is that comprehension and cognition. So not only do you read the words off the page and accurately turn that into information, but can you then understand, what's the motivation of the characters that I'm reading about? What's happening in the story? What year did whatever get invented, the Snellen chart get invented, comprehension. So these are all important factors for a fully functioning visual experience. One thing I think that most of us don't realize until something goes wrong is that vision is a learned skill, which sounds crazy. Walking is a learned skill too, right? So we're biologically programmed to learn how to do it. But you can take a look at any group of people and see that some people learn to walk a little bit better than others. Same thing happens with vision. We are biologically programmed to learn visual skills, but we don't do so equally. Some people really have a tough time developing those visual skills accurately, and some people are elite. And those, a lot of times are your star athletes, have extremely well developed visual skills. So during your routine eye exam, they're looking at just that bottom part of that pyramid there. They're looking at healthy eyes and do you need lenses. When we do an evaluation, we're looking at all these other areas that are important for reading. So what can you do right now that can help foster that love of reading, even if your kid is struggling? So the first thing that you can do is read with your child. And a lot of times, I know this sounds like basic stuff, but a lot of times as kids get older, um, it seems less natural to read with them. And that, and you get to a teenager, they might not want to read with you, but then again, they may be, you may be surprised. Reading to your child, even as an older kid, can be a really nice opportunity for bonding. And if even if they don't want to read with you, audiobooks count. So audiobooks can be a great tool for an older child who's still struggling with reading, who maybe doesn't want to read with mom or dad or be read to. Having somebody else read with them can also be helpful, like having a friend, an aunt, a babysitter, um, some other trusted family member can sometimes fill that role that maybe the kid just doesn't want to do with a parent. Um, but for those younger kids who are, just maybe picking up reading a little bit slower, setting a routine of like, okay, we're going to always read for 10 minutes before bed, or you're always going to practice reading for 20 minutes after dinner. Putting that routine together helps foster that just a program of this is what we do. It's not an optional thing. It just becomes part of what we do. When you're reading with the kids, a lot of times doing the voices really helps. I'm not that great at this. My husband is better, so a lot of times he's the guy who reads to the kids. Um, but having a child participate in this as well, asking them like, how do you want me to do the voice? Or, what kind of voice should this character have? Can be a really great way to build engagement. Um, and again, letting your child pick the book can really help too. Now, of course, some books just aren't fun for the parent to read. So a lot of times, if your kid is always picking stuff that you just hate, hate, or is just, not valuable reading material, give them a choice of two or three. We're going to read, which one of these do you want? And that way you don't get stuck reading like the completely horrible stuff. Um, and especially for younger kids or really squirmy kids, multitasking is fine. Coloring or Play-Doh, something like that, can sometimes get them to sit still a little bit longer and listen while you're reading, even if they're not necessarily looking at you. So sometimes kids actually need to not be looking at the page to really understand the information coming in, because sometimes if their visual system is not working the way it's supposed to, in order to visualize, they may need to actually close their eyes or look at something, non-challenging like Play-Doh, for example. So don't necessarily, assume that they're not listening if they're not looking at you or not watching the pages you read with them. Like I said, audiobooks count, especially for older kids who, might give you a little pushback about reading together. Audiobooks are great. And then discussing what you read with a child often will develop that engagement as well. So even with an older kid, if they don't want to read with you, but if you're both reading the same book at the same time, or they're listening to a book at the same time as you're reading it, it still develops that engagement with the material. So despite what your second grade teacher said, graphic novels are awesome. I admit, I used to be a snob about this too, and thought, well, that's, what do you need pictures for? And then I went back to school and learned a little bit more. So some of the great things about graphic novels are the blocks of text are not very wide. And if you have a child who has difficulty with eye movements, smaller chunks of text are easier for them to track and to move their eyes across accurately. So that's one reason why graphic novels can be really helpful. For a child who has trouble with visualization or seeing that picture in their mind's eye, having those pictures in the graphic novels can bridge the gap. And for a lot of kids, just having multiple modalities of that information coming in can help them understand and retain the information more than they would if they were just reading text off a page. It can also just be more fun for kids, especially if they're resistant to reading. They may, if it's a story about their favorite superhero and they've got the graphics to go with it, that can be really helpful. And then also for older kids, there are a lot of graphic novels these days that are geared toward, teenagers even, and that may get them interested in reading because there is age appropriate material, but it's visually easier to read. So another thing that I have had a lot of success with a lot of our patients is using an e-reader. So Kindle, Kobo, Nook, there's a lot of different ones. There's actually an article I think that came out pretty recently in Wired magazine talking about, the best e-readers for 2023. So when I say an e-reader, I specifically mean the ones that have what's called an e-ink display. So the e-ink display is black and white. There are a couple of color e-ink tablets that are available. They're really expensive though. Maybe not what you want to buy for your 7 or 8-year-old. So the reason that the e-ink display is a good option is that it's very similar to paper in terms of how our eyes interact with it. It's not shining light bright into your face. And even the ones that do have lighting, they're lit from the side. And that's a lot easier for our eyes to focus on as well. So a device like an iPad or a computer screen, the light is actually emanating from the screen and shining directly into your eyes. That's not normal for our visual systems to deal with. Every other, thing that we look at, unless we're staring straight at a light, which hopefully you're not doing, the light that we're seeing is reflected off of the surface. So an e-ink display is also reflected off of the surface. So that's part of the reason why it's easier on our eyes. Also, just the way that the letters are constructed on the screen is easier for our eyes. Some of the reasons I really like e-ink or e-readers in general is that, like the graphic novels, you can set it up so that there's less information at each time for the child to look at. So you can adjust the type of font, you can adjust the sizing of the font. And then for those kids who have a lot of trouble skipping lines, especially, you can increase the separation between the lines. That can make it a lot easier to read. There was a study that came out a few years ago now that was looking at kids who were struggling readers and what type of displays work best for them. Now, they didn't use an e-reader. In this particular one, they used a phone, but the narrower the screen that the kid was reading from, the easier a time that they had because they didn't have to track across the line as far. So that can really help. So like I said here, you can have toddler size print, but adult level reading material. So if you've got an older kid, or your mom, who's having trouble with smaller font, it can really open up a huge world by being able to enlarge that font size. Another thing that some books have, but not all, some you can have simultaneous audio with it so that they can listen at the same time that they're reading. And that can be a really great support, especially for kids who they're reading, but they're not very confident yet in their reading. So a few other things that could help with making sure that your kid is set up optimally for reading, or yourself, is making sure they've got the right prescription on. So like I mentioned before with the vision screenings, a lot of times kids who are farsighted, which means that they can see far, not so much up close, a lot of times those kids are not caught by that vision screening. So they may benefit from having additional support for reading, so a little bit of magnification. And a lot of times it's just a little bit that makes a huge difference. So having the right glasses makes a huge difference for a lot of kids. Having good lighting really helps too. So you want to make sure that, if you are reading, off your phone, you adjust the brightness to an appropriate level so that you're not squinting at it because it's too bright, or squinting at it because the sun is out and it's too dim on the screen. Having, reading in the dark, it's not going to make you go blind, like your mom said, but it can cause eye strain and cause discomfort, which may make you want to put the book down a little sooner. Having a good working distance, and this is another reason why, reading off a phone is not really ideal, although I have to admit I do that myself sometimes. Your ideal working distance is if you put your knuckles up to your eye, how far away your elbow is usually the appropriate book reading distance for most people. So the working distance for someone who's 5 feet tall is going to be different from someone who's 6'2". So a child's working distance is going to be a little bit closer than that for an adult. But you don't want to have them holding things really close. A lot of times, and again, there's more studies on this too. When people read off of a phone, for whatever reason, we tend, even when the font is big, we tend to hold it much closer to our faces. So if you're going to read off a phone, try to put it on a stand a little bit further away. Having good posture too. I'm sure you've seen plenty of kids who have their neck just like completely tipped down. That's going to wear you out faster. It's terrible for your neck. Don't want to do this. So you can see in our little diagram here, having a 22-degree angle relative to your desk is really your optimal angle for reading. So another thing that you want to do is make sure to take breaks. So there's, the American Optometric Association has put out this 20-20-20 rule, which makes it easy to remember. So every 20 minutes, take a break for 20 seconds by looking at something 20 feet away. And that's great because it's easy to remember. But actually, more research has come out recently suggesting that you really need like 3 or 4 minutes of a break of looking far away to let your eyes kind of reset back to their like pre-reading level of tension. So you might be better off taking a break every half hour for 3 to 4 minutes, 5 minutes, get up, walk around. It's always good for us too. And then don't forget to blink. When we read, we don't blink as much. When we read off a screen, especially a computer, we blink even less. And that is going to cause blurriness, dryness, irritation, grittiness. So a lot of symptoms you can get just from not blinking enough, especially in the winter. So some bonus tips there. So there's a lot of great resources for kids and adults. So the Montgomery County Public Library and the DC Public Library, as well as many others, have plenty of free ebooks that you can, download onto any kind of e-reader. They've got audiobooks for free. And there's also the Maryland Digital Library. If you're a Maryland resident, you can sign up for this Maryland Digital Library. They have I'll send out the link when I send out the slides. But they've got a lot more resources than just Montgomery County Public Library. They also have story times for younger kids. They've got book clubs for older kids. So there are a lot of options to help support that love of reading. So, a lot of times kids are, in school, they're dealing with some of the symptoms and they're not dealing with the underlying problems. So, while working around the symptoms that they have is good and important, addressing the underlying issues is even more important in the long run. So, questions from anybody? Let me pull this back up. No questions. All right, everybody's tired. Well, if nobody's got any questions, I will say good night. And I'll send out the slides in the recording after our talk. It's going to take I don't know, usually a couple hours for the Zoom to do its thing, and then I will let you guys know when we do another presentation. So thanks for coming. Really appreciate it.
I think we do have a question in the
Oh, we
chat
do have a
about
question.
how dyslexia plays into it.
Oh, okay, dyslexia. Thank you. Thank you, Martha. So dyslexia is oh boy. Yeah, dyslexia is a I hate that word. Okay. Um dyslexia is often misused. So the problem that you run into is that in like all the academic research and the literature, when they talk about dyslexia, they're talking about a very specific reason for not being able to read. That is a separate brain processing disorder that has to do with how your brain understands sounds and matches them up with the letters. And there's some other stuff that goes along with it. It's a neurodevelopmental disorder. That being said, among kids who have that type of dyslexia, there is a higher incidence of vision problems, which can compound the dyslexia. There are a lot of kids who are labeled as dyslexic when really what's happening is they've got an eye tracking problem, an eye teaming problem, an eye focusing problem, or a visual processing problem. Also, to make it a little bit more confusing, is you can have dyslexia and all those other problems at the same time. So I hate that word because it's like saying, you can't walk. Okay, well, why can't you walk? Because your leg is broken, because you don't have a foot. I mean, the way you're going to address it is different. So when a kid has that kind of label, you really need to dig a little deeper to figure out exactly what the problem is and where it's coming from. Are there ways to identify vision issues with children that are not developmentally ready to read? Yes. Definitely. We actually see kids as young as 6 months old. At that age, we're looking for, are the eyes intact? Are we seeing symmetry in their development? Are they being able to follow things with their eyes the way that they should? But even with kids who are nonverbal, we can pick up vision issues before they can tell us. Now, is it easier when they can tell you? Yeah, sure, it's totally easier. But we can get a pretty precise prescription, even if a kid needs glasses, even on a kid who can't tell you. Absolutely. So that's a great question too. Let's see. Any other questions here? Dyslexia. Oh, what should it be called? Oh gosh. I don't know. Dyslexia is probably a good catch-all term, but it's just there's a lot of confusion there. Just like lazy eye, there's a lot of confusion with that, and we can talk about that on another night. So, any other questions? In the chat or out loud? I really appreciate everybody coming out tonight. I know it's getting kind of late, so okay. ophthalmologist says eyes are healthy, but seems to have problems. So, okay, so just like I mentioned, you know, in that one with the triangle, so you can have completely healthy eyes, but not have good eye coordination. So you could think of it as like, you know, just because your fingers work doesn't mean you can eat with chopsticks or play the piano. It's a skill that you haven't developed yet. So it doesn't mean that there's structurally anything amiss. It's just you haven't developed the appropriate coordination yet. So same thing with the eyes. You might not have learned how to track across a page. You might not have the muscular coordination to make the two eyes look at the same place at the same time, at least most of the time. So that you can have problems there with completely healthy eyes. I would say, you know, 99% of the kids that we work with, if not more, have completely healthy eyes. There's nothing wrong structurally. So, yeah, so that's usually not the problem. So, strabismus. Oh yeah, strabismus. Dr. Ifunai, can you talk a little bit about your experience with strabismus? The question is, can
Yeah,
strabismus be healed or treated without surgery?
so it definitely can be treated without surgery. I'm actually an example of that. I didn't find out that I had strabismus until I got to optometry school. So strabismus is just a fancy way of saying someone has an eye turn, whether the eye be in, out, up, or down. And for example, I'm going to try to see if I can do it on command, looking at the camera, where I can turn one of my eyes in, have a little bit of double vision. I'm not using both eyes together. So when it comes to vision therapy and vision rehabilitation, we try to strengthen the eye and the brain connection so that the patients or the individual is going to be able to have the awareness to understand what their eyes are doing. We do that with different filters, prism, and different activities in therapy so that patient is able to appreciate what it looks like when they're using both eyes together compared to not using both eyes together.
Thank you. All right. Anybody else? Sarah, thanks for your comment. That's great. Dana, yours too. Thanks. Great. Well, we're going to do more of these workshops. You know, like I would say the hardest thing I had to do tonight was taking slides out because I could talk for a week. And I don't want to do that because nobody wants to hear me talk for a week. But you might be interested in bite-sized pieces of some of the information that we have. So we'll be doing more of these over the next several months. And we'll send emails out and let y'all know. Thanks so much again for coming in.
Thanks for joining us, everyone. Have a great night.
Catherine, thanks for your feedback. Good night, all.